Hello, I'm Dr. Alan Kivitz of the Altoona Center for Clinical Research in Duncansville, Pennsylvania, in the USA. Today, I would like to share with you key findings from the open-label extension of the mobility trial as published in RMD Open in August 2019. In this open-label extension, or OLE as we call it, the safety profile of sarilumab remained stable over 5 years of follow-up and was consistent with interleukin-6 blockade. The clinical efficacy of sarilumab, as observed over 52 weeks of treatment in the parent study, Mobility, was sustained over 5 years in the open-label extension. The best outcomes were evident in patients who were initially randomized to sarilumab 200 milligrams in Mobility. The present analysis included 901 patients with moderately to severely active RA and inadequate response to methotrexate who completed 52 weeks of double-blind treatment in Mobility. In the open-label extension, all patients received sarilumab 200 milligrams administered subcutaneously once every 2 weeks, plus weekly methotrexate for a total of 5 years. After 5 years of treatment with sarilumab, there were no new safety findings, and the safety profile was consistent with IL-6R blockade. The most common adverse events were injection site erythema, neutropenia, upper respiratory tract infection. Importantly, although absolute neutrophil count less than 1,000 occurred in 143 patients, or 13% of the population receiving either dose of sarilumab, ANC normalized on treatment in 104, which is 73% of these 143 patients, and such events were not associated with increased rates of infection or serious infection. The majority of patients who temporarily discontinued treatment with sarilumab due to low ANC were able to continue or reinitiate sarilumab at a reduced dose of 150 milligrams every 2 weeks with no apparent clinically meaningful impact on long-term efficacy or safety. The clinical efficacy of sarilumab, including inhibition of radiographic progression, reduction in disease activity, and improvement in physical function, was sustained over 5 years. While initial treatment with either dose of sarilumab was associated with significantly better radiographic outcomes versus placebo over 5 years of follow-up, the best outcomes were observed in patients initially randomized to sarilumab 200 milligrams in the randomized clinical trial. At year 5, each of the original mobility treatment groups had substantial decreases from baseline in cite score, and among patients who had been assigned to sarilumab 200 milligrams in Mobility, this decrease translated to an 83% reduction from baseline. After 5 years of treatment, mean DAS28 CRP score was similar among the 3 initial treatment groups, with patients who had been randomized to sarilumab 200 milligrams in Mobility achieving a 62% reduction in DAS28 CRP. HAQ-DI results were similar to those observed for CDI and DAS28 CRP, and scores at 5 years were similar across groups, with patients who had been assigned to sarilumab 200 milligrams in Mobility achieving a 47% improvement in HAQ-DI. In this open-label extension, or OLE, sarilumab demonstrated consistent safety and durable efficacy, including inhibition of radiographic progression over 5 years in adults with RA who had inadequate responses to methotrexate. These results support the long-term use of sarilumab for such patients. I sincerely thank you for watching, and I encourage you to access the full article available on RMD Open website.